So GOG 265 was a very interesting phase 2 trial using a novel immunotherapy approach in patients who had recurred and had already gone through one line of chemotherapy. Just backtracking, if you look at the last 30-40 years of cervical cancer in the United States, there have been only 3 FDA approved drugs, which is staggering compared to breast, where there have been about 60 FDA approved drugs to treat breast cancer. And the last 2 happened recently. The last was topotecan, and then bevacizumab, again based on a GOG study, showed if you add that to standard chemotherapy, it made a big difference in survival. But we are still so far behind the 8 ball, and hence immunotherapy is a very exciting way of trying to help this unmet need, and there are various ways you can do it. So GOG 265 was an immunotherapy trial using a compound called Axal, where they use HPV 16 E7 epitope and combine it with a common bacteria which is inactivated, which is Listeria. And then this combination is given intravenously as a vaccine. So what does it do? Once the vaccine goes in, it's picking up by antigen presenting cells, and then it causes a tremendous HPV specific T cell response, which goes and then attacks the HPV attacked cancer cells. It's important because cervical cancer is almost all HPV caused, so it's a unique and a fairly robust way of targeting it. And on the back end, what this compound does with the Listeria is it makes the tumor microenvironment better by downregulating inhibitory molecules like MDSCs and Tregs, and that's why this is a very robust combination. It has multiple ways it acts. There are no neutralizing antibodies because most of the Listeria is taken up inside the cell.